APHA going around doing 90-minute presentations. But there was that. But then the other thing he was notorious for was coming up and sabotaging your presentation. Because, and I can't believe we actually had PowerPoint back then. I don't think we did, but if we had overhead slides on a projector, does anybody know what that means? Yeah, okay. He would come up and he would unscrew the light bulb. And if you had some other sort of visual aid or whatever, he would somehow sabotage that, because he also said, don't depend on your supplementary sort of modality as a crutch. And another thing, which I'm going to break that cardinal rule, because I had them pull up the slides so I can catch a glimpse of what it was I was going to be talking about. So let's we can go ahead and get the. Or can you do that, or do you do that?
It should be remotely.
Sure, if I just say next slide or something?
Yeah.
All right. So let's go to the next slide and see what it is I'm talking. Yeah. Okay. So again, I said it's been about 20 years. I started as a public health student in 1997. Back then, they had this thing called the Epidemiology and Public Health Student Organization, or EPSO, or then it was EPSO, and now it's something else. So, but back then, I was fortunate enough to be elected by my peers as the president of the student organization. And then 20 years later, I got elected for whatever reason, and I still feel like a poser, as the president of APHA. So there was kind of a long pathway as a 20-year sort of journey there. Again, starting off with APHA Leadership. And back at that time, one of the things that the student organization did was we tried to find opportunities to get students to be able to go down to APHA and present at the annual meeting. And I think that there's still some type of a piece of that still in existence. That was my first introduction to APHA. Was as a Yale student, we had to, I think it was part of our community project, that's something to do with vancomycin-resistant enterococci and hospital use policies and so forth, something like that. But our community project, we had to get that accepted, an abstract accepted by APHA, and then go down and present. So that was part of the actual class, and so that was fine. I mean, we were successful in that. But my first APHA experience was the 5 people in my group piled into my little Ford Festiva and drove from New Haven down to Washington, D.C. Got this crappy little hotel off of DuPont Circle, which there aren't crappy little hotels off DuPont Circle now. They're all nice hotels off DuPont Circle. But that was where we stayed, in sort of the old game where you send 2 people in to register and get the key, and then everyone else parks the car and sneaks in later, because we were, I'm sure, too many people in the room. And then the other piece of that first APHA experience was that as a student session, we were scheduled for like 4 o'clock on Wednesday afternoon. For folks who don't know APHA conference schedule, the closing session is from 2 to 4. And so, pretty much everyone's already gone. They checked out of their hotels. They're probably at the airport by the time we were presenting. And so it was a room full of, I think, 10 tables of 8, all students, and we just decided to present to one another. So it wasn't a lost experience. But that was my first APHA experience. And I'm happy to say I've only missed one annual meeting since then. And I happened to be, it was the year after I graduated from Yale. I was working with the WHO and I was living in Rome, and I wasn't going to come back to wherever APHA was because I was already in Rome. So, whatever, that wasn't going to happen. But since then, I've always been back at APHA. The other piece of this, and are folks familiar with the Connecticut Public Health Association? Any members of the Connecticut Public Health Association? That's an affiliate of APHA. That we have 54 local affiliates, and Connecticut has one. Ohio has one. That's where I was when I left my experience in Rome for family circumstance. I have a sister with developmental disabilities, and my mother had passed from breast cancer, so I moved from Rome back to Akron, Ohio, to take care of my sister. And that's when I started working at the local public health department, and thought, well, this is different, but okay, this is where we follow life's path. And that's when I got involved with the Ohio affiliate of APHA. And it was my boss that said, hey, you're doing public health work, you need to be part of your professional association. And that was sort of a new concept to me, because that's like, don't you just go and do your job? And said, no, you go and you do your job, but then you enrich that experience by conversing with other folks in the field, right? And sometimes you need to do that through professional associations. Are really a great way to do that. So I got very involved with the Ohio Public Health Association. The other very valuable lesson that my boss told me is that don't join anything, engage in things, right? You can just pay your membership dues, but now you're just writing a check. That's called a charitable contribution. That's not called a membership due. Membership means you're becoming a member, you're becoming engaged, you're learning something, you're contributing something, a little blood, sweat, and tears sort of thing. And that was a message I took to heart. So I became very involved there, ended up representing the Ohio affiliate of APHA at a regional level on something at APHA called the Council on Affiliates. And so there are 10 different regions, it was like HHS regions. And so I represented them on this Council of Affiliates and represented the Ohio Public Health Association on APHA's governing council. So again, introduction gave me one more reason to go to the conference. It gave me a closer network of people, because if you just go to the APHA conference, it's you and 15,000 other people, right? It's that next step is finding that niche, finding that little community within APHA in which you can engage, that has folks that can kind of help you along that development. So that for me, that was the Council on Affiliates. I enjoyed that so much that when my term was coming to a close on the Council on Affiliates, because I was no longer representing my affiliate on APHA's governing council, because I became the president of my local affiliate. Right? So as the president of my local affiliate, I was no longer part of the governing council, but I wanted to stay involved with APHA. So I joined their action board. And the APHA's action board is a group of folks that try to translate the policy statements into action, right? So APHA does a lot with policy statements. They do a lot of advocacy work. The idea of this action board is to say, well, okay, what can we learn from the policies and how can we then put that into action? So I extended my stay in APHA leadership by joining the action board. Then this other opportunity came up. It's called the Affiliate Capacity Building Initiative, or ACBI. And this is a major grant that APHA applied for from Kellogg Foundation. And the idea there was that they were going to try to bring in money to help the local affiliates develop capacity. Because a lot of the local affiliates, and I don't know what Connecticut's Connecticut Public Health Association looks like, but back in the day, before this grant, Ohio was literally, the membership was run on a notebook, and the office was a volunteer secretary who got some space in her basement that she occasionally would send out membership dues notices and things like that. That we truly were that kind of association and had somewhere between members. But this capacity building initiative was intended to bring some more money to the local affiliates to develop that capacity, maybe hire a part-time executive director, that sort of thing, and do some strategic planning and business planning and so forth. So my involvement with that, and now that some years have passed, it's okay to share, I guess. I helped in writing the grant to Kellogg from APHA, and then I wrote the grant from my affiliate to APHA to try to get some of that money once we got the award. And I was on the selection committee that helped decide who got those grants. I did recuse myself when my affiliate came up, but it was, these are things, this is how you get engaged, right? This is engagement. It's not going to a meeting, and it's not listening to folks. It's speaking up. It's telling people what it is you think. You're bringing something to the conversation, okay? And then because of all that involvement, I decided, why not, let me run for executive board, and I made it by a couple of votes over the person behind me, but that's fine. Had an opportunity to chair strategic planning for APHA, and all this time I'm thinking I'm a poser. I still think I'm a poser. I think it's just because I was hyper engaged that I got the opportunity. But sometimes that hyper engagement gives you credibility so that you're not really a poser. Sort of bet yourself out. So anyway, I became the vice chair of the executive board, chair of the executive board, and then when I was coming off of APHA executive board, I decided to run for president. APHA doesn't have very many presidents that you don't start your name with doctor, right? I'm an MPH, right? I'm not a PhD, not an MD, not a JD, not an FND, just an MPH. And I ran for APHA president. I ran against someone who was a national voice, a national presence in public health, Dr. Kamara Jones, who is really leading the conversation on social justice and race and discrimination and so forth, and as drivers of health inequity. As soon as I knew I was running against her, I kind of thought, well, let me start fighting for next year, and it worked out that way. And then the next year when I ran, APHA also has a little bit of a tradition of if at first you don't succeed, try again, because next year you'll probably get it, because folks really wanted to be nice and recognize your input. So anyway, so that was my path. 20 years in the making, and I didn't pay attention when we started, and I don't want to cut into other folks' time. We're doing okay. So why APHA? And so the value of APHA was really sort of that it gave this great big perspective. I can't imagine of a public health association that can allow you to explore so many different perspectives of public health. APHA is a home of academics and researchers and instructors. APHA is a home for advocacy folks, policy wonks, the folks that create the space in which we practice public health. APHA, to not as much of an extent as I would like, but growing, is a home for practitioners of public health, like myself. All right, my day job is I'm a health commissioner in a small health department in central Ohio. Right, not some big. I'm not New York or San Francisco or Chicago. I'm in outside of Columbus, Ohio. Right, but APHA gives that opportunity to have that broader perspective. APHA, for folks who don't know, a couple of little factoids about APHA. The oldest, and try to make the way to say that, we have the longest history in a professional public health association at 145 years. We are definitely the most diverse in terms of our interest and our ability to attract folks, whether they're policy folks, advocacy folks, practice folks, students. Our student members of APHA are far and away the most active, and Suparna, I think, will be talking about that. Or Ryan, Suparna is also going to be talking today, but Ryan is our current chair chair of the student. Oh shoot, he's going to kill me. The student, it's not the student assembly. Student assembly. Thank you. Sorry about that. And then so APHA also is probably, I think, easy to say, the largest opportunity to disseminate research, whether it's at the annual meeting where folks are presenting in live time, they're in real time, the work that they've done. But APHA is also the home of the American Journal of Public Health. I don't know if folks were aware of that, but that is under the APHA umbrella. The other is networking. I mean, when you're engaged, networking won't happen by writing a membership check. Networking won't happen. Relationships don't happen because somebody donated some money to make sure that you are members of APHA. That's great. That unlocked the door. You got a free pass. You're APHA members. That's huge. It would be a missed opportunity if you don't engage, make a connection, make the network. Because the network happens. That's all relationship building, and that actually has to come from the member. That doesn't always go out the other direction. We have another slide coming up. Whoever's pushing the slides, push one. Let's see. Yeah. Okay. How is this? I think this is part of the how is APHA sort of evolved over time. APHA is a membership organization. A third or so of our revenue comes from membership dues. We have another third that comes from the conference, and another third that comes from contracts and programs like that. So, the story's evolved a little bit over time. Membership organizations are definitely sort of in a strange time right now because professional organizations aren't the automatic decision that they used to be 20 years ago. I mean, you just join your professional association. Now it's sort of a, gosh, I don't have a lot of money. Where am I going to invest? So that's a little bit different. So we're finding new ways to attract members. This is one of them, through having an institution support student involvement. Evolving priorities. Once upon a time, when I joined anyway, it was, I think the mantra was 100% access, zero disparities. Right now we talk about what we mean by access. It's not just access to health care, it's access to health. And certainly healthcare is a big piece of that. But what are the other things? When we talk about access to health, now we're starting to open up that conversation where we talk about health equity and social justice and the barriers between someone's current state and their ability to be healthy. So a lot of social constructs. And then when we talk about zero disparities, now we talk about health equity and removing those barriers that exist between your current state and a healthy state. It's been my experience anyway, or my perception, that APHA is increasingly involved in advocacy. I can't imagine a time in my life where that is not more important than right now. We have a non-public health friendly environment that we're living in, and so advocacy and policy development, evidence-based policy development is critical. APHA is a nice home for that, right? It's very well resourced to do that sort of thing. One of the other primary drivers of APHA's strategic plan is to develop a public health workforce. And that's where we're trying to invest in making sure that that students are ready to come out, that folks that are already out are practicing at the highest level that they can. So we try to make sure that we're disseminating best practice information and so forth. And then building the public health movement. We do that through a variety of different campaigns, a lot of awareness, a lot of saying, hey, if nothing else, drop a buck or two towards this activity. If you can, write letters to the editor, speak your mind, use social media is one of the great things that students can do better than anybody else. And to actually be part of that groundswell of interest in public health. We have more public health programs in schools than ever before. Every month, it seems, we get another one. There's a lot of folks being educated in public health. It doesn't do any good unless you put it into practice, right? Even if you're not in the field of public health, use that public health lens once you get out 10 years down the road and you start realizing, like, what am I doing? Use that public health lens. I think that maybe, again, I don't want to step on other folks' time. So are we about?
Yeah, I think we're about out. So let me pull up the other speakers. Okay.
So Ryan will probably call me out for not saying student assembly right. So, yep. Okay, I'm just about.
Camera.
Are
we good now?
Yes.
Can you turn that down?
Yeah. Can y'all hear him though? No.
Okay, hi everyone. My name is Ryan. I'm the chair of the Student Assembly, and I am pretty excited to talk to you guys today about your membership and kind of how you can get the most value out of it. I did want to discuss a little bit on how I got involved with APHA before I switch over, because I think my journey is similar to a lot of you. You kind of join this organization and you're lost and you don't know what to do. So I started out thankful for Saparna. She'll speak a little bit. She was my mentor in how to get involved with APHA. And I started out as a campus liaison, just learning the ins and outs of APHA. And then I attended my first annual meeting in 2014. And then since then rolled into Student Assembly leadership on our council and have worked my way up to now chair for this next year. So the Student Assembly, we're an entity of APHA, and we are the largest student-led public health organization in the nation. And we're a place for students to really share information and ideas with each other, talk about our science, the work that we're doing, how can we be the new generation of public health. And it's a key way to network with some of the professionals in the work environment that you may not have the opportunity to do so. Next slide. So our mission is to improve the future of public health by promoting excellence and professional development for students in public health and related disciplines. So this is a perfect time to mention that we are not all public health students in the Student Assembly. We have approximately 6,000 members. We have over 30 countries represented, and we have many degree programs. We have individuals who are in undergrad, public health, health sciences, nursing, and then we also have master's students, PhD students, JD students, and medical students. So we're really a hodgepodge of students who are all here to work in common ground to really just improve the health of our nation. Next two slides, sorry, I should have showed you that. Yeah, so this is how we are set up. So we consist of an executive board or executive council, and that's made up of the chair, chair-elect, immediate past chair. We also have a treasurer, treasurer-elect, and then secretary and secretary-elect. Each of us, we have our own work group that we work with, and this is where you can get involved. We'll send a call for nominations out every once in a while, and this is where we promote different work groups that we have and opportunities to learn a little bit more about APHA and improve everything moving forward. So for example, I'm working with the programming work group this year. So if you submitted an abstract to the annual meeting, which I hope some of you did, we will be reviewing it, and I will work with Dixie, our programming chair, and we'll make sure that you get what you need. If you have any questions, we also have the student meeting committee, and they are making sure that the student meeting day, which is the Saturday of annual meeting, that it is an opportunity for you to get something that you may not get anywhere else. We have local speakers usually come in and discuss a public health issue that's related to the theme of the annual meeting. And then we also have an afternoon of sessions that are focused on student professional development. We'll talk sometimes how to spice up your CV, your cover letter, how do you sell yourself on social media and other online platforms to really get the most out of it. So that is kind of how we're built up. Next slide. And I mentioned a little bit already some opportunities for leaderships that you can get. So we have the council leadership roles, which I just mentioned. And we also have these other three, which are the campus liaisons, regional student liaisons, section liaisons, and membership ambassadors. These are all leadership roles that you can take on during your time. And you can promote APHA at your campus. You can promote student assembly within the sections, or you can reach out to new members and welcome them to the student assembly and to APHA. So they have a little bit more of a personal connection with the organization. Next slide. We also have awards and grants through the student assembly. So we have the Action Grant, which is the advocacy on campuses that impact our nation. That is a competitive grant which rolled out, deadline was this past week. And this is where they can promote different advocacy campaigns that you do on your own campus. We have the chair citation, which is given out every year. And we also have the outstanding student abstract, where we will select an abstract that stood out compared to the other ones at the annual meeting, and we'll award that person the outstanding student abstract, and it comes with meeting registration, financial reimbursement, and a plaque. So this is really an opportunity for you to put yourself out there a little bit more. Next slide. At the annual meeting, you do have these perks. As I mentioned, you have the National Student Meeting. We have the scientific sessions, which are all about talking about the work that you're doing. This can be a class project that you did in class, or the research that you're assisting with, or even your own research. And this is a competitive session, so you can put this on your CV and say, I presented at the largest public health meeting, and it was accepted. We also have annual meeting scholarships that will help with your travel and your registration, and you'll attend some sessions as a requirement and learn more about the science that you may not know of, or learn something completely different. And we also have a speed mentoring event, which is where you can sit down and talk with mentors, leaders as well in APHA, or you can discuss with someone you've never met and just really talk about how to navigate, how to be mentored and be the best public health professional that you can be. Next slide. And then you have your traditional perks, your APHA perks. So we have the news and views, which we send out, and you get news in public health. You can get an in-depth look and see how things work. We also have student-focused webinars, which we create. So we'll sit down and we'll figure out what is important right now for students, and we'll collaborate with another section, and we will do a webinar and really hit on what you need to know as a student and how you can help with it. And we also have the opportunities where we'll send out postdoc positions, we'll send out job postings, and just let you know what is coming out, so that way you can get the most out of it, and you may see something that you may not have known before. So that's all that I have. Fran, if you'd like to step over, I want to make sure to give everybody some time to discuss.
Greetings, everyone. My name is Fran Atkinson, and I am the Deputy Director of Member Services. And my responsibility is to work with the components, and those are various groups within the organization that you can get involved with. Now, like my journey, my personal journey to APHA, funny enough, is like 2 weeks from now will be my 15th anniversary here. And when I first came here, I had no idea what public health was about, because my expertise is in association management. So I worked with physicists as well as I worked with psychiatrists. But one thing I can say is I have loved working at this organization because the people are passionate and I'm passionate about these issues, whether it's access to health or whether it's health equity. Although I'm doing association management, I do feel like I'm contributing because I'm working with people like you and other public health professionals. So that's my journey. Been here 15 years. If you could do the next slide, please. So I mentioned that we are responsible for various groups, and as you can see, we have 31 sections, 2 special primary interest groups, 5 forums, the student assembly, and the 17 caucuses. Now, if I could have the next slide. Now, you're probably asking, what are the differences with these different groups? Well, the sections and the SPIGs are very similar. They're based on interest or profession. So you'll see food and nutrition, you'll see health admin, you see epidemiology, you'll have public health nursing, and I'll talk a little bit more about that. And then, as I mentioned, for the SPIGs, next slide. We have the pharmacy and veterinary public health, and they are very similar to sections. They're just trying to get to the section status based on criteria. The next slide, please. So our forums, you can also join, and these are groups that cut across different sections. So an example would be the breastfeeding forum, where you'll find members from the maternal child health section. You'll find folks from food and nutrition, international health, all coming together and developing sessions to address the issue of breastfeeding. So as you can see, there are 5 different groups. And again, you can join at the most 3 of the forums. And also, it's important to know that you get 2 sections with your membership. So next slide. Okay, so the caucuses. The caucuses are part of APHA, but they are their own organization. So what you'll see is that the caucuses are focused on social issues, as well as based on different groups. So say, for instance, the Black Caucus, they will be having their 50th anniversary this year. So you can belong to the Black Caucus, Latino Caucus, also social issues, homelessness, peace, again, they are groups that are external to APHA, but affiliated with APHA. Okay. Next slide. Oh, that's it. Okay. So that's a quick overview of what the various member units are. And what I want to emphasize is that you really take advantage of these different groups. So in order to do that, if you have not selected a section or 2 sections, as I mentioned, what you can do is go to the website, apha.org, and on the right side of the page, the upper right, you'll see a blue button saying log in, and you can use your username and password, and that was sent to you last fall And you can then go to update public health interests, and that will enable you to choose a section that, or the two sections that you would like to participate in. So why join? What's the benefit of being a section? Well, the sections can be your home. You'll be with individuals that have the same interest as you. So if you're interested in HIV/AIDS, you can join the section and learn what other individuals are doing in the field, as well as what you're going to hear again and again as far as being a member of APHA is that it provides you with networking opportunities as well as professional development. There's no better place to be because you can work within the section as well as meet these leaders that are like in the field and known across the states as well as the world. And some of the things that sections do achieve and like what you can work on include writing policies, as far as like advocacy. Also, you could help with webinars, also participate on the online community, which is APHA Connect. But like, again, volunteering, that can be your resume builder. I can't emphasize, there's so many opportunities within the organization, whether it's going to be volunteering in the student assembly or whether it's volunteering with your section or in a caucus or a forum. And the leadership is clamoring to have students participate, and especially with your knowledge in terms of like technology, you can add so much to each of these membership groups. So again, like, how can you get involved? It can be as simple as posting something on APHA Connect, or more difficult in terms of working with the leadership and writing a policy. So like, there's many different ways that you can volunteer, and like, it depends on like how much time you want to put towards it. But there's always a place for you. So like, there was a question as far as which sections are more active. I would say that, like, in all honesty, they all are active, but like some sections will focus on one area more than the other. So some sections will focus on the advocacy piece, some sections will focus on like building their scientific sessions for the annual meeting, and then others will focus on policy. So, and like, what I would encourage you to do is, if you have an interest in a specific thing, whether it's like advocacy or policy, reach out to the leaders, because like, you can make the difference as far as like where the focus goes. So definitely contact like your section chair or your membership chair. Those are the individuals that can bring you into the component and really guide you through in terms of becoming more familiar with APHA. And again, it goes back to the networking piece. In addition, one thing that I do want to say is that we've been really active in terms of doing a lot of collaboration across the sections over the last couple of years. So an example would be that maybe about 4 or 5 years ago, we have a gun violence prevention group, which is made up of the maternal child health section, also is made up of injury control as well as mental health. And what they were able to do was have a town hall on gun violence prevention at the annual meeting, and they were able to bring in a parent from Sandy Hook to talk about the issue, as well as like CNN covering this at our annual meeting. And we continue to be very strong in with that group working on gun violence prevention. And trying to get the information out as far as how it impacts us from a public health standpoint. We also have an opioids group, and some of those sections include like our alcohol, tobacco, and other drugs section, public health, nursing, as well as mental health. And some of the things that they're doing are having webinars. So this year, like we've had our first webinar on opioids, and I believe in the coming weeks, we'll have our second webinar on that issue. And again, it's coming from a platform that's cutting across the various sections. So it's very valuable. Okay, and then the other three groups that I'd like you to pay attention to is climate change, also focusing on the ACA, as well as public health prevention funding and rural health. So those are definitely some of the groups that you'd want to participate in. Also, based on what I see in the breakdown of your schools, we have an environment section, we have a statistics section, epidemiology, as well as we have a community health policy, and actually community health practice and policy development. Sorry about that. So there's so many opportunities for you. So please take advantage of them. And if you have any questions, like I believe my information will be at the end of this presentation. Take care now. Bye-bye. Charlene.
Hi, everyone. My name is Fran, and I am the current chair of the Council of Affiliates. So I'm here representing that affiliate perspective and what local public health looks like, or local affiliate public health. So for those of you that don't know, there's APHA, our national organization, and then each state or region has their own local affiliate. So both of these organizations are separate and distinct, but they work really closely together. So APHA knows that it couldn't succeed without its affiliates doing work on the ground, and the affiliates know that they'd be at a loss if they didn't have all the support and resources that APHA has to offer. So there are 54 affiliates, and Tom mentioned that already. So each state, there's 50 state affiliates, including Puerto Rico, and then some cities or regions have their own affiliates. So California has a North and South affiliate, and then there's an affiliate for New York City, the District of Columbia. So depending on where you go after you're done in Connecticut, there'll be somewhere for you to find a public health home. So definitely check out whatever affiliate is within the region that you're going to be working in. So there are lots of benefits to professional organizations, but specific to affiliates, it's more locally and regionally tailored to meet the public health needs of that specific area. So state affiliates or public health affiliates have local conferences. Some have their own journal that they publish on a routine basis. They do local advocacy campaigns. They provide opportunities for networking and professional development. So all affiliates operate differently, and they have a different range of services, but the benefits of affiliate membership are really connecting you with local something local. So whether it's local networking, local professional development, it's really something that you can get involved in. And sometimes it's a little more tangible than being a member of your larger national organization. So it gives you something that's local that you can, be, more you can really get involved with all the tangible work. And again, those affiliates all have different types of activities that they put on throughout the year. Some do things for National Public Health Week. They do annual meetings. So really finding out, what affiliate you'll be joining, and then seeing what types of activities you can get involved in. So how do you join an affiliate? If you are unsure of where to even get more information, the APHA website has a whole section, a whole website devoted to the affiliates, so you can find out more info there, or you can just do a simple Google search and see what's in your area, or outside of Connecticut whenever you go back home or wherever your professional world takes you. I would encourage you all to join your local affiliate while you're a student. It's the best deal in town. So similarly to APHA membership, where students get a pretty significantly discounted rate, there's some affiliates where you can become a student member for just $10 a year, which I don't know any other organization that you can get a membership in for that amount. So definitely check it out. And similar to APHA National, there are student sections within affiliates. So you can get involved and network with other professionals that are at the same, in the same place as you. So, being able to network with other students and then getting those connections to, other health professionals or mentorship opportunities from within your affiliate. So I know we've covered a lot of ways to get involved. So I have some more for you. So you'll have all kinds of options to choose from. So there's, not only ways to get involved as a leader and grow your leadership skills with the national organization, but within your affiliate, there's lots of ways to get involved and grow those skills as well. So you can join a section and become a section leader within your affiliate. You can sign up to, facilitate a committee or a work group. You can join the board of directors. It really just depends on what's happening within that local affiliate and what those opportunities look like. There's more formalized leadership opportunities in the form of officers within the board of directors. So affiliates have, again, all of this is very similar to APHA. They have a president, they have secretaries and treasurers and an executive board. There's also something called the affiliate representative to the governing council, and that's your affiliate's voice at APHA. So the way that I got involved with APHA was through my affiliate. So I came up through all of these different leadership opportunities that I just mentioned. So when I was in grad school, I volunteered for our Idaho Public Health Association's communication work group. But hey, I'm young and cool. I can totally do social media. So my first involvement in the Idaho Public Health Association was doing their social media. So like us on Facebook, please. And then from there, I just have this bad habit of saying yes to things. So I was asked to be a part of the board. I said yes. Someone said, "Do you want to be secretary?" Sure, why not? I can totally do that. What about president? How about you run for president next year? Sure, great. That sounds wonderful. So that's how I, came about, my affiliate track and the leadership opportunities that I've been afforded. And then from there, again, I have a bad problem with saying yes. So our region needed a representative to something called the Council of Affiliates, which is that group, that governing body that represents affiliate voices at APHA. And I was like, sure, I can do that. I'll be the regional rep for Idaho, Oregon, Alaska, and Washington. Why not? And then similarly from there, someone said, "Hey, do you want to run for chair?" Yeah, great, sure. So here I am. It's been a wonderful experience, and all of these different leadership opportunities have been really helpful, not only to help me grow personally, but also professionally. So it's really neat to be able to, work with all of my colleagues, so Suparna and Ryan, and the rest of, and Tom, and then the rest of the APHA executive board. It's a neat experience to be able to sit on a leadership board for such a large organization. So there's lots of ways to get involved. I really would encourage you to check out your affiliate and see what opportunities they have for you to get more involved in, and really just making it so you have both that local and your national professional organization, because they both do different things that really help support each other. So that is all that I have. So I think now I'm turning it over to Suparna.
Yep. Hi, everyone. So I don't think I have much time left, but I do want to tell you about my journey. So I'm a PhD student at Kent State University. I'll be finishing this year, so I'll be joining the ECP group, as I'll talk about later. So the way I started off was I came from an engineering background. I joined an MPH program and was elected to be the president of the student council. And because of that position, my university decided to give me an APHA membership. And because of that, I was the campus liaison, as Ryan had mentioned, as one of the opportunities to get involved. So they sent me to my first annual meeting, which was in Philly. So that was in 2009, almost 9 years ago. And so I went there, and it was completely overwhelming. I'm not going to lie about it, and nobody else that spoke today is going to lie that the annual meeting is overwhelming. And I've gone to 8 of them so far. So I got there, and I was like, what do I do? So I first went to the different sessions. I was like, all right, I'm interested in diabetes and in cardiovascular health. Let me go find let me go hear about some speakers. Went to those sessions. It was fascinating. The student assembly actually has, on Tuesday evenings, they have their business meeting. So I decided to, peek my head in, and lo and behold, it was just the board members of the student assembly at that point. So I walked in, I'm like, hi guys, so I want to get involved. They're like, oh, we would love to get you involved with things. And I was like, uh-oh, what did I just do? And like Charlene and Ryan, everyone else, we just can't say no. It's not even a say yes, you just can't say no. So from then, I started reviewing abstracts, moderating sessions at the annual meetings. I stayed on as campus liaison at EVMS, and then I went to the University of Louisville, stayed as campus liaison there. And then there was a call for volunteers to help at the student meeting that was going to be held in Washington, D.C. that year. So I was like, sure, yes, I'll volunteer. And I actually was the right-hand woman to the director. And that's actually how I got sucked into the student assembly. So the next year, I was the student meeting co-director in San Francisco. And then I ran for treasurer-elect. So I was treasurer and treasurer-elect for 2 years at the student assembly. And then I ran for the chair-elect of the student assembly and had that position for 3 years. And then at the end of so I'm actually the past chair of the student assembly. So I was Ryan 2 years ago. And so last year, actually 2 years ago, I decided in my immediate past chair role that I wanted to run for the Intersectional Council Steering Committee. So the ISC, and in public health, we're all about acronyms. So the ISC is actually the chairs, chair-elects, and the immediate past chairs of all the sections and SPIGs. And so they actually elect 3 people every year to a steering committee that does the business of the Intersectional Council between the annual meetings. And so I got elected to that, and I actually got elected to be the chair-elect of the ISC for this year, which means that next year I'll be the chair and, taking care of things there, which I'm very excited, but also very nervous about. But also in the meantime, during all this, I also got involved with my section. So I'm an epidemiologist. So I got involved with the epi section and was their student liaison. Now that is a elected role, which is very exciting. So now every section has a student liaison, and most likely will get a student. They'll all have like student work groups, which is where it's a perfect place for you all to get involved and meet other students within your sections, as well as meeting the leaders and other individuals within your sections as well. So when it comes to public health and APHA, so APHA has really helped me out in my career. If I wasn't involved with APHA, I'd still, being a member of an organization such as APHA and how the past speakers have spoken so highly of APHA, it's a great way to meet other researchers and individuals in your field. Like I have met with some of the some authors of papers and people that I've referenced in my own research, and it's exciting for them to say, hey, call me by my first name. And it's like, oh, wow, that's awesome. Thank you. So, and Tom's already talked about this, we're a big public health family. I see the same people every year, and it's just fascinating. Ryan, I dragged him into being a part of APHA, and I'm not taking that back because he's a fascinating leader, and I know he'll do great in his work this year. But there's a lot of ways to get involved, and so I'll be graduating this year, and I'm very excited about that. And I know that even though when I first started out as an APHA member is because my university signed me up. But I stayed on because of what APHA had to offer me and what I learned about myself as a public health practitioner. And so a way to do that is the early career professionals. So in addition to all the benefits that Fran had talked about, the ECP group also has 3 other different benefits. So one is there's a library within APHA Connect, which is our online community. So in there's all the archives for resources with regards to job searches, career development, as well as all the past webinars that they've had. You also have access to bi-monthly webinars that are exclusively for the early career professionals. So some past webinars have covered topics of personal branding, time management during the job search, effective job search strategies, professional networking, and emotional intelligence on the job, just to name a few. And actually the next webinar, if you are an early career professional already, which I don't think you all are, will actually cover tailoring your application materials to the job that you're applying for. And then finally, there's the Leadership Institute series, which is also exclusively for early career professionals. And that's all presentations that are led by past President Joyce Goffin. And the series started off last year with a presentation titled Collaboration for Professional Success. And then the second of the series was in January, and she spoke about transforming organizations using systems thinking. So this is a great way to get involved and stay involved with APHA. Is once you finish your student membership, you are eligible for 2 years after graduation to be to sign up for an early career professional. And you can stay in that role for 3 years. And it's at a reduced price, so it's a great way to stay involved with that as well. But I know I went through that all rather quickly, and I'm sure you all have a lot of questions. But I'll just end up saying that, you know, my colleagues have also always told me that whenever I start talking about APHA, I just like perk up, and, you know, I'm very excited about everything that's going on. And like everyone else, I just can't stop saying yes, and I won't, and I never will. And I know Fran and everyone else is nodding on the nodding right now, but APHA is a great way to get your foot in the door in public health and find your own little niche. So thank you.
Yeah, recognizing the time, and I appreciate the folks that hung out. It doesn't look like we're going to have a lot of time for questions and answers. We will have the contact information for all of those folks who presented, as well as my own. Just a couple of quick take homes. Everybody universally has said all I had to do was say yes. That's about how hard it is to get engaged in APHA, is when somebody asks, say yes. But also don't be afraid to ask. Also remember that these are public health folks. They're friendly folks. If you hop online and at the APHA website and go to one of those sections, whatever that section most appeals to you, and you see that section chair's name and email address, email them. That's why they're there. They're nothing special, all right? It's a good read. They're all wonderful special. But one of the things to remember, you're entering into a profession that is very horizontal, right? There's not this huge hierarchy of super magnificent, wonderful people who you're not allowed to talk to. One of the memories that I'll always cherish from my involvement with APHA, and one of the returns on my investment of blood, sweat, and tears over the years, was last year, 2 years ago, at the APHA annual meeting. I got invited to a dinner because I was the incoming APHA president. And it was a dinner sponsored by the Royal Society of Public Health from England. And I spent the next 3 hours at that dinner sitting next to Michael Marmot. And if you don't know who that is, Google it. Social determinants of health originator kind of guy, right? I mean, this is public health hero stuff. That's what we mean by networking. APHA is an organization that really just sort of opens all doors. There aren't any doors. Just walk through, right? But engage, be active, and don't miss the opportunity. You've been given actually a wonderful gift with this membership. Use it. Don't miss it. Use it.
Great. Well, then we will, if you guys are okay with it, provide your information if someone has a burning question. And Tom will be with us this evening for the Alumni Speaker Series. So if you want to chat more, that's a great opportunity for it. But can you just welcome or like join me in thanking everyone so much for their time?
And also thank you to Elsie and Ellen and Caitlin and all the behind the scenes people who put this together. So I think that's it for us.